The nervous system, which is a collection of nerves and specialized cells, is divided into the central nervous system and the peripheral nervous system. As the body's electrical wiring and main form of communication, the nervous system must always be working properly. There are a number of different types of diseases that can affect the nervous system, including brain tumors. Brain tumors are masses of abnormal cells that divide uncontrollably. Whether benign or malignant, the primary characteristic of all brain tumors is their ability to rapidly grow. Brain tumors are defined as malignant and overpower healthy cells by depriving them of nutrients. When a malignant tumor metastasizes, it travels away from the site of origin into other parts of the body.
Primary brain tumors are relatively uncommon if you look at all cancers. For example, lung, breast, and colon cancer are much more common than primary brain tumors. However, primary brain tumors still are a significant problem, and they're fourth or fifth on the list of leading cancer problems in general. Primary brain tumor symptoms are usually identified by neurological symptoms or pain. This can be headache, sometimes neck pain, nausea, vomiting, just a feeling of being not quite right. The cause for brain tumors is still somewhat unknown. This is in contrast to lung cancer, where we know that smoking is a very definitive and defined risk factor for the development of lung cancer. The development of brain cancer still today is largely unknown. There are some genetic conditions and environmental factors which will contribute to the development of brain cancer, but it's much less defined than the development of other cancers in the body.
There are several steps doctors take in order to diagnose patients who have symptoms. The first is a neurological exam. This exam tests the patient's reflexes, muscle strength, eye and mouth movement, as well as coordination. If a patient fails their first examination, their doctor may suggest an MRI, CAT scan, or X-ray. Glioma is the most common type of brain tumor in cancer patients. They account for over 30% of primary brain and CNS tumors in the United States. Glioma is defined by any type of tumor that stems from the supportive tissue of the brain. Glial cells, called astrocytes, oligodendrocytes, and epidermal cells can all produce malignant brain tumors. Astrocytomas originate from the connective tissue of the brain. In adults, astrocytomas are the most common form of brain tumor and manifest in the cerebrum. The cerebrum accounts for all voluntary movements, as well as 2/3 of the brain mass. Patients suffering from these types of tumors usually experience increased intracranial pressure, changes in behavior, and seizures. A second form of glioma is located in epidermal cells, which develop in the lining of the ventricles and spinal cord. Because they are commonly found near the cerebellum, tumors block the flow of CSF, increasing intracranial pressure. Compared to other brain tumors, ependymomas are slow-growing. However, they can reoccur after treatment and become more invasive than before. Optic nerve gliomas manifest on the nerves that communicate with the eyes and the brain. Patients experience loss of vision and depletion of hormone control. Because of the surrounding sensitive brain structures, ependema is very difficult to treat. A third type of glial cell cancer, oligodendroglioma, comes from the supporting cells of the brain. This cancer is found in the cerebrum. The most common symptom experienced by patients is seizures, headaches, weakness, and changes in behavior. Oligodendrogliomas have the best prognosis and survival rates. According to doctors, treatments solely depend on the growth of the tumor when they catch it. For instance, if the tumor is growing slowly, doctors may want to watch it with the use of MRIs. However, if the tumor is growing at a faster rate, surgery may be immediately needed?
Brain surgery and spinal surgery tends to focus on the removal of the tumor in its entirety. In the past, we thought that this required larger incisions to fully expose both above and below an area of tumor and around its sides. As technology has advanced, particularly with microscopes and endoscopes, which are cameras on the end of long tubes where we can put the camera very close to the tumor itself, we've learned that we don't necessarily need a longer incision to completely remove a tumor.
With new research and technology coming out every year, patient rates of survival are continually climbing.